Before I joined this esteemed body, I was retired as a CEO of an education group. We had 650 employees. A fair number were part-time. Anybody who was scheduled more than 9 hours a week on a regularly scheduled basis had health care. Had health care for themselves, and they could buy health care for their family relatively inexpensively. The Affordable Care Act, when that came into place and the requirements were finally rolled out by HHS, increased the costs for part-time employee health care by 50% year one for my company. So my question for Ms. Robinson or Mr. Dicken, did you do any analysis as you looked at the fraud, the waste, at the immediate impact on health insurance premiums, never mind co-pays and deductibles, for privately sponsored health care programs and what the impact was in the first few years?
We've not directly looked at the changes in employer-sponsored health premiums. There are some surveys that look at that by other organizations, but GAO has not reported on that.
Did HHS look at this issue?
We have not looked at that issue. Our focus is really on HHS dollars and the expenditure of HHS funds.
Well, but as my constituents view it, whether they're money that they pay for premiums, whether it's the employer paying for premiums, whether it's their tax dollars that they pay to the federal government, it's all their money. So would it not make sense to look at waste as is viewed in terms of the immediate and then long-term impact on health care costs in America by looking at what is suddenly the change in costs were? As I indicate, for our company, was dramatic, and a number of others I know of.
Yeah, and certainly we're glad to work with the subcommittee on looking at healthcare costs and trends in the markets. Certainly employers, there have been longstanding increases overall in health insurance costs, even for federal employees have seen increases in healthcare costs in recent years.
Let me change directions for a second question. There were concerns with those that were receiving subsidies or the payments. Can you tell me how many people in year one received subsidies that were improper or determined to be inaccurate the first year?
So that's a very important question. We don't have the number of folks, but what we did look at was the risk to the programs of potentially weak controls on eligibility.
Let me ask you, why? I mean, we're subjected to audits as a company. Why would we not know how many people received subsidies that were found to be inappropriate and in fact or fraudulent, whatever term you want to put on it? How would we not investigate that and not know?
So, Congressman, my office does investigate when we get allegations of an improper person being in the marketplace. Our work initially set out to figure out whether there were adequate safeguards to prevent fraudulent or improper information from impacting the eligibility determinations.
So at this moment, we still don't have either year one or any year since any idea of any approximation of the number of people that received payments that we should not have.
My office does not have that
Does
information.
HHS in general have that?
I don't know.
That would lead me to believe that we don't know how much those inappropriate payments total up to be to the taxpayers. Is that correct?
I do not have that information.
Mr. Dicken, do you have that information?
No, but I will note that the GAO has recommended that HHS develop a fraud risk assessment to get at some of the questions that you are getting at, so they have an overall understanding of what the fraud risk potential is and how they can manage those risks.
Now, I readily admit, as they say, I'm subject to freshman hazing here as a freshman member of Congress, but I spent 35 years in private business, and I have to say, oh my God, how is it that we don't have a means by which to figure out those that we didn't and how much it's cost us, yet we're analyzing fraud and abuse? How do we not think about it was a problem?
Well, Congressman, I think you're raising a really important question about transparency in government. And one of the things that we have been recommending to CMS in the marketplaces is to look at things like having the right kinds of data to be able to figure these things out. And so, for example, in our work looking at the accuracy of the subsidies, what we...
Well, let me stop your
Yes.
question. But if we were making a payment to a private carrier or somebody else, we certainly would insist on that kind of transparency of them, and we'd recover the money if it was improperly paid, wouldn't we?
Yes, Congressman.
So we failed to undertake a basic function of the Department of Government, which is to make sure we're not throwing money out the window.
And Congressman, that's why we've done the work we've looked at the controls that CMS has on the accuracy of the payments, is to be able to make recommendations to strengthen those controls.
Thank you very much. Thanks very much. I go back.
I thank the gentleman.